Sarah, thank you so much for joining us today. Sarah is a registered midwife. She is also a lactation consultant and a pregnancy reflexologist.
That's correct.
So thank you very much for joining us today to answer some of those questions that I know I do and did in my previous pregnancy, and also when I was breastfeeding my daughter, I Googled. Always so many questions. Everybody does. So I thought it would be really nice just to ask you some of those questions so that we could actually hear from an expert rather than some kind of scary forum about the answers and the realities and the truth behind some of the myths and things like that.
Sure.
Excellent. Should we get going?
Yes, let's.
Perfect. Okay, so the first question is, how will I know when labour has started?
The $1 million question. Yeah. So it's a question that every woman wants to know, and especially women having their first baby. Despite reading and listening, there's no definitive answer. That it's the big mystery. So, but you need to know, because you need to know when to seek help should you need it, which you will at some point.
Yeah.
So it's good to split labour into two parts. One is the pre-labour part, and one is the established labour part, the long part where your cervix dilates. You remember that?
Many hours.
So the pre-labour part is when your cervix is softening and shortening and getting ready to dilate.
Yeah.
And that's often the bit that women are unsure about. And typically it presents with you having an off day. It can start any time from 37 weeks of pregnancy through to 42 weeks. Wake up, feel that you have menstrual-like cramps, backache, feeling a little bit emotionally unstable, and a bit nauseous sometimes. So, and sometimes you have a little bit of a mucousy show, which even can be pink in colour. So, good time to perhaps take some paracetamol and hunker down and go to sleep if it's possible, because it's a good sign that the dilatation phase or the first stage of labour is going to start. And that's the long bit, that can take on average 10 hours.
I wish it took 10 hours. That would have been lovely.
Oh.
Mine was long. Very long.
Yeah, it can be long.
I think
First
with your
time.
first, yeah.
Your first time, yeah. So sleep's everything. So during that uncertain pre-labour phase, just bear in mind that it's really important to sleep. And not just mum, but dad too, because don't forget, if you want support, then, you both need to be rested.
And also, it's nicer then when you don't need them so much for them to sleep. I know that I was actually at the birthing centre and I could not sleep. Obviously, I was in the final stages of labour. I was in excruciating, I was having a lot of surges and contractions. And Joe had been up for, 40 hours and just conked out on the bed, fast asleep, snoring. And I was like, you're not sleeping. It was the worst time for him, but he was exhausted. Of course he was.
Yeah, of course.
So he needed to sleep. But that was the worst. I would have preferred that he slept earlier on than when I probably needed him.
So you have the benefit of hindsight.
Yes. Okay, I think I'm going into labour. Why don't you have a nap?
Yeah, exactly. So here we are, we're telling you now what to do.
Yes.
Right, be
Let
prepared.
Let your partner have a sleep.
Yeah. And then it's the second, the sort of the dilatation phase. And that's, theoretically, it's defined as when you're having regular contractions, so about every 5 minutes, they're lasting for at least 30 seconds, and your cervix is dilating. Yeah. But of course, you don't know for sure whether your cervix is dilating, because very few women can assess their own cervical dilatation.
Yeah.
So you probably won't know that until you go into hospital, if in fact you're having a hospital birth. But but you'll know, because it's painful. It is painful, and it's meant to be painful, but it's all positive pain.
Yes.
So
there's a good end.
There is, and I think it's worth mentioning as well that not all women are aware of a pre-labour phase, because it can be a bit worrying if you're sitting at home waiting for a pre-labour phase, but in fact you just start contracting.
That's what happened to me. We were watching a wildlife programme, and I was like, because I didn't have any Braxton Hicks, and I was a week over a week late, and suddenly I just started having regular contractions every 5 minutes immediately. And I was like, oh, this is it. I think I'm going into labour. My husband was like, I think you wouldn't be able to speak. And I was like, no, this is it. It's every 5 minutes. Little did I know that was the start of a very long journey.
No, it can be, but it could have been. It may have been the way it started.
Yeah.
My labour started like that.
Did it?
Yes, and continued. Just at a galloping pace.
Yeah.
But the pushing stage was something else. So don't be worried if you find what you think to be pre-labour is intensely uncomfortable, and you get worried about having to pace and cope with that pain.
Yeah.
It might not be pre-labour. Maybe you went through pre-labour when you were asleep.
Absolutely. Everybody's body
is different. Thank goodness. So different.
That's why I always think it's a bit dangerous to share birthing stories, really, because some people, it's so easy for them and the baby literally just pops out.
Exactly.
And for other people, it's a very different story.
It is, yes. So don't forget, you're all very unique.
Yeah, absolutely. So the next question is, what happens when labour is induced?
Okay, so let's think about why labour might be induced to begin with. Most commonly, labour is induced because you're edging towards 42 weeks of pregnancy, and current research suggests that perhaps it's not a great idea to go beyond 42 weeks of pregnancy unless that's something that you really want. So usually your NHS midwife will start having discussions with you when you reach, they'll make a plan with you really about what happens if you reach your due date and you don't go into labour.
Yeah.
Not that it has to be executed to the letter, of course. It's always flexible and negotiable between both of you.
Yeah.
But it is, most women like having a plan because they like to know what the next step is, and how long the pregnancy might be allowed to continue.
Yeah.
So in its simplest form, induction of labour would be a sweep. So where we try to separate the fetal membranes from the cervix and release some of your own hormones, oxytocin. And often that works. You might need it done once or more than once, but that's the most straightforward, natural form of induction.
Yeah.
Harmless in almost all cases, but wouldn't do it, for example, if the head wasn't in the pelvis. That would be a silly thing to do. Or if you had placenta previa, we definitely wouldn't do that. But you'd be having a C-section then.
Yeah.
So then if that doesn't work, and you are 41 plus weeks, you will probably be given a date for an induction, what we would call a medical induction of labour.
You don't have to have it, because they wanted to do that with me, and I really didn't, because I wanted to give birth in a birthing centre.
Yes.
I believe that as soon as you have to be induced, you have to go to the labour ward. You can't do it in the birthing centre, is that?
Well, I think some birthing centres vary.
Okay.
Some of them will allow you to have the hormones that are inserted up around your cervix.
Okay.
The Propess, well, it's like a tea bag or a tampon.
Okay.
And you can have that and you can go home, and I believe you can come back into the birthing centre. But in fact, if you need to have the intravenous drip, which can be a little bit more painful and therefore a reason why women will more readily opt for an epidural, yes, then you're heading for the main labour ward.
Yeah.
So if you wanted to go to the birthing centre, you probably are better to put it off as long as you and your caregivers feel comfortable to do that.
I think for me it was, I was 41 weeks and there was no sign that I was going to be going into labour, and I had a sweep. And they said to me, if this doesn't work, we want to induce you. And I said, look, I don't want to be induced. I think the baby's just not ready to come out. I don't think it's a problem. I just think it's not ready to come out. And I know in France that 42 weeks is actually quite normal for women to continue, but different countries have different ideas around these things. So I was unhappy with that. And they said to me, well, what we would need to do then is you would need to come in, I think they said every day, for us to make sure that the the placenta is holding up.
That's right.
And that the nutrients and oxygen is still going through the umbilical cord.
Of course, yes.
So that there are options is what I'm. They weren't very happy about that. And I had to be quite strong.
Yes.
And I think that some women, if they're unsure, then maybe they'll just be led. Whereas that may not actually be what they want to do.
Yes, that's right.
But there are options.
Well, I mean, as you did your reading and you went in armed with the information.
Yeah.
So I think that's important because that gives you the confidence to say, hang on a minute.
Yeah.
Do we really have to go down this route now, today? So you're exactly right. Some extra monitoring might be implemented.
Yeah.
Because typically the fluid level, the amniotic fluid around your baby can reduce once you go over your due dates. And it can happen overnight sometimes.
And they want to be safe. You
They
understand
do.
why they do it.
Because your baby's, fully developed, usually nice and big, and it can be nursed in a cart, breastfed at that stage.
Yeah.
But of course, going into labour naturally is always going to be the slightly better, easier option as a rule. But yes, you could have the hormone placed up around your cervix to ripen it, so it does that pre-labour phase that we talked about before. And then once that may trigger your body to actually take over the process and it will labour by itself. So you may only need that the hormone around the cervix for 12 or 24 hours. And thereafter off you go, which will be great. And you can go into the birth centre.
Yeah.
Some women, though, need more than one of those hormones inserted around the cervix.
Yeah.
And then some women indeed need to go on and have a drip to to make contractions start.
Yeah.
And at some point, then your waters can be broken because that accelerates or speeds up the process as well. So there are options, and it's really hard to say what will happen in what order and how long it will take for any given woman.
Yeah.
But it is true to say that it's usually a slightly longer process. So you need to be prepared for that.
Yes. Okay, brilliant. Thank you. Why is induction of labour viewed negatively? I know I viewed it very negatively because I felt this is not natural. This is not, or my body's just not ready to do this yet. Therefore, I don't think you should force it to do it. Are there other reasons that it's viewed negatively, do you think?
Well, yes, definitely, because you see where I suppose what we're doing is forcing something to happen that isn't yet ready.
Yeah.
And when we do that, or we go against nature, sometimes it fails because we've interfered.
Yeah.
So induction of labour is one of the biggest reasons for caesarean section, because the induction fails. And what I mean by fail is that, eventually you might get into labour. We don't know how long that will take, but if it takes time, ultimately what happens is baby gets tired.
And mum gets tired.
Mum gets tired for sure.
I was exhausted. I mean, 40 hours I couldn't sit down or lie down because my contractions started going backwards. I spent 5 hours bouncing up and down on a birthing board trying to get my waters to break.
Oh, really?
Yeah, my body was just not interested.
Did it work?
No, it didn't actually. I got a good workout though.
Take that one off your list.
Burn some calories.
Yeah,
it was exhausting. But mum gets tired.
Yes,
and that, if I hadn't been really, really fit, then I'm sure I would have just said, okay, I'm done. I need to lie down, do whatever you need to do.
Of course.
Take this baby out because it's not coming naturally.
Well, that's the other reason why it's viewed negatively, because you are much more likely to opt for an epidural. Yeah. And of course, when you opt for an epidural, you're introducing, many more drugs, synthetic drugs, that can have, temporary effects on mum and baby. Then they're not dangerous effects. It all evens out in the end. Yeah. But they are drugs at the end of the day. And sometimes, it takes away. Well, certainly it makes you less mobile in labour, even though you can have a walking epidural.
Can you?
Well, you
How
can.
Does that work?
Well, because
does it take all sensation out of?
Well, no. I mean, good anaesthetists and units where they've got plenty of midwives, they will not just numb you where your pain centres are, your receptors are, that supply the uterus. So your motor function, your leg, in theory, shouldn't be numb. But it requires, you know, somebody quite skilled to do that. And it's true to say that most women don't have a walking epidurals. At most, they might manage to sit up in the chair. But because it reduces your mobility, it reduces how active you can be in the second stage, the pushing stage. And so you perhaps may not be able to get yourself into a great position for pushing. Of course, the midwives will help. But you know, some of it's got to come from you too, and you may not feel that urge to push in the same way. When it's your first baby and you've never pushed before, sometimes it takes a while to get the hang of it. So therefore, you're more likely to end up with a vacuum birth or forceps, and then you're more likely. You have an increased likelihood of having an episiotomy. So you see it's a cascade of intervention. So you start with what you think is one harmless thing, like inducing labour, but it just cascades down. And then, of course,
that doesn't always happen. Some people have an induction labour and it's fantastic and it's perfect, and they wouldn't have it any other way. It's just, you're just highlighting what could happen and why it's viewed negatively.
Why some people view it negatively, of course. Yes.
Okay. How can I avoid the induction of labour?
Right, gosh. All right. Well, avoiding induction of labour, I think induction of labour is partly to do, or avoiding it, is partly to do with how healthy, mobile you keep yourself in pregnancy. If you manage to keep your weight down to a healthy level, you'll be more active. The more active you are, deeper baby's head tends to go down to the pelvis. And when the head's in the pelvis, in a nice position, more pressure on your cervix to release those hormones that trigger labour. You know, that's really, really important. And also babies, you know, you don't need to have 9 and 10 pound babies.
Want to have 9 and 10 pound babies, do you?
No, so as long as baby's growing on its curve, staying on its curve during pregnancy, and it's not dropping below it in weight, it doesn't really matter how little weight you put on in pregnancy. If you're feeling well and you just grow a nice average size baby.
And everybody's body stores different amounts of water, and I know I put on 20 kilos in my, but it wasn't it was water. I was storing a huge amount of water, and then as soon as I gave birth, all that water went, and I was almost exactly the same as I was before pregnancy. Even though I put on 20 kilos.
I know, it's incredible, isn't
amazing.
it? But of course, you know, when you put on all that weight, it does make you less active. It makes you feel less like getting out there, walking, swimming, doing your training, walking to work instead of taking the bus, and all these things help.
Absolutely.
Especially in the later stages, it helps your circulation, so you don't get that pooling of fluid. Also, in terms of diet, if you reduce your salt intake, you're less likely to retain fluid. And we do know that excess glucose intends to increase your amniotic fluid volume. And if you have an increased volume, you know, you have this big baby, or what appears to have a big abdomen, not a big baby. So I think there are ways that you can help. There are no guaranteed ways, but you know, some of the alternative therapies can help too, such as pregnancy reflexology.
Absolutely, which you do.
That's right, yes, and with some quite good success. You know, if there's, you know, but with all of these things, you don't want to wait until you're 40 weeks, because then you're firefighting. You reach that golden day, suddenly the labour doesn't start.
Like, I'm giving birth today.
No. So if you want to give birth, you know, sort of around your due date, it's better to implement these things earlier on. So at 36 weeks, if you're going to start some sort of therapy with the idea of it helping to initiate labour, start then. And the other thing is keeping your bowel empty.
Okay.
You know, because you want baby's head to win that space in your pelvis. So if you're on iron tablets, which can make you a little bit backed up, and make sure you've got good roughage, plenty of fluids, that keeps things moving.
And the exercise as well.
Yes, the exercise helps keep it moving for sure. So that's really very important too.
And there are lots of different positions for labour which are really helpful to just try and encourage that baby's head down.
Oh, there are the opening up, the stretching up, opening your pelvis. Because don't forget that your two main, the pelvic muscles and ligaments and those bones down the front there will separate because your pregnancy hormones relax the ligaments. The relaxing, exactly. And just that, just that sort of half to a centimetre is enough for baby's head to go down into the pelvis. So open up. So once you know that the baby's in a good position, and ask your midwife to palpate your abdomen. For babies in the anterior position, then start opening up, get baby's head tucked down and, lined up for labour. Yes.
Now, what is a sweep? I know very well what a sweep is. I had many, many, many sweeps.
Did you?
Yes. Yes. But what is the official definition?
Okay, well, a sweep is where we separate the fetal membranes from away from the cervix. And
so what are fetal membranes? Because that sounds...
The membranes are the membranous fibrous tissue, a bit like, well, it's like the membrane that you have around chicken that's around your baby, protecting it. And they're fairly it's adherent to your cervix, and your cervix is what we want it to dilate. And so by separating them slightly with our finger, we release the oxytocin, the pregnancy hormone that initiates labour. So what we're physically doing is inserting our fingers up through the vagina around your cervix. If we can, pop a finger through your cervix and separating those membranes away, encouraging that release of hormone. That then, if you're lucky, sort of between 12 and 36 hours later will be enough to trigger labour to start. So a sweep, as I said before, is sort of the most natural way of starting an induction of labour, if you like. It's the old-fashioned way, yes.
So you've explained how a sweep is performed. It is performed by inserting the fingers into the vagina and basically doing a sweep with your fingers.
That's right. And remember that it's, we can't see inside your vagina. So it's completely a touch technique. We're relying on what we can feel with our fingers. So lying on your back is the easiest way for us to access the cervix. And also, if you can relax the vaginal muscles.
It's definitely easier said than done.
I know it is. But if maybe you want to practice this at home before you go in, because if you imagine the effect that tensing your buttocks, your vaginal wall muscles has, if you just pop your own finger into your vagina, if you're lucky, you've still got good muscles down there.
It's your first baby.
That clenching should have a gripping effect on your fingers. Now, if you're doing that to the poor midwife or doctor that's trying to sweep the cervix, it does hinder. And it's not that we're trying to be, unsympathetic when we say, oh, just relax, but it really does help. So if you can sort of, and putting your fists underneath your buttocks, so you're raising up your pelvis towards the person that's doing the examination, does help too, especially if the cervix is leaning towards the back a bit.
Okay. Is a sweep painful?
Well, everybody's perception of pain is different. I think that having anybody inserting their fingers into your vagina at any time is never pleasant. The end stages of pregnancy, when you're feeling uncomfortable and cumbersome to begin with, and vulnerable. Let's face it, you do feel vulnerable, and you're very much in protective mode, of your baby. So it's uncomfortable. It would be wrong to say it's not.
It's like having a smear. It's not pleasant.
No.
But to begin, my first sweep was it was just uncomfortable. But as I had them with the aim of trying to speed up my labour, they were getting more and more aggressive.
That's
swoops,
right.
And then they were getting more and more painful.
Yes.
But if you just have one at the beginning, it's just unpleasant.
It's
not
just, yes,
painful,
no,
really.
it's not. No, and we're not, and unlike a pap smear, we're not inserting anything except our fingers into the vagina, and our fingers tend to be a bit softer than a speculum.
Yes. Some have short nails.
I hope they do. Yes, it's true. But they're definitely worth doing as a first step of triggering labour. Yes.
Do I have to have a sweep?
No, you don't have to have a sweep. It's always negotiable. You should sit down and have a chat with your midwife. You may have very, very, very valid reasons why you don't want to have a sweep, why you don't want to have any vaginal examinations, and of course that's okay. But if you're terrified of having a sweep, please just open your mouth and discuss it. Maybe you're just one of those persons where we do give you extra checks in other ways.
Yeah.
And we see how that goes. But
and remember, it's your body. They can't make you do anything.
No, not at all.
They have very strong opinions often, but you don't have to say yes.
No, not at all. You're right. It's your body. You can only, you can choose to take advice or not.
Yeah.
I mean, it's true to say that most women do, and if you don't want to, if you wake up and you think, oh, today's the day I'm having my sweep, and you're really, really not in the mood to have it, then pick up the phone and do tell your midwife. Just, you're tired, you didn't sleep properly, maybe you're feeling really bunged up and constipated, whatever the reason is. Lady I saw yesterday, boiler had broken down.
Yeah.
She couldn't have a shower.
It's inconvenient.
Well, it was inconvenient, but she didn't want to go and see her midwife without having a bath or a shower. And that's valid too, because you're never going to relax, in which case.
So, can reflexology be used to induce labour, and how?
Well, reflexology is one of those wonderful therapies where it's deeply relaxing. And anything...
Particularly in pregnancy?
Well, particularly in pregnancy,
Is it the increased blood flow in the body?
Certainly it helps the circulation, for sure.
Yeah.
It makes your legs retain fluid less. Yes, I think it allows your feet and your legs to be more mobile, which enables you to be more active.
Yeah.
But I think reflexology is a therapy where it's fairly non-intrusive, and depending on what sort of person you are, when you're right at the end of your pregnancy, you might not be in the mood for a full body massage, but you might not mind revealing your ankles and your feet for some massage. But I think the deeply relaxing nature of the therapy is always good, because the more relaxed you are, the more likely you are to give in to going into labour. Sort of trying to allow yourself to be free of all your routines and get into a relaxing frame of mind. Because body always prefers that when labour's about to start. So it can, we can work on certain points on the foot, which we can work on the pituitary, which we know triggers the release of oxytocin. That would be on your big toe area. We work a lot on lymphatic drainage to get rid of fluid, and directly on the uterus once you're full term. So yes,
it's lovely.
It's lovely.
It's lovely. It's one of those you feel like you're indulging yourself a little bit.
Well, yes, of course. I mean, it is fairly indulgent,
Yeah.
but I think it's important that you have somebody do the treatment who's experienced with pregnant women.
Yeah.
Because pregnant women are a unique group. And I think you need to feel safe with that practitioner. I think that's very important.
Yeah. So what happens during a pregnancy reflexology session?
Well, it only differs slightly in the way that you perhaps sit or lie for treatment. When you're very heavily pregnant, we don't want you lying flat on your back.
Yeah.
So we would typically have you sitting up on a couch, or if it's at home, we would prop you up with some pillows on your bed or a couch or something. I think that's the main difference. And then, depending on how many weeks pregnant you are, depending on how much pressure we apply to the feet, if you've come with the express intention of wanting to get into labour and you're already sort of full term, 36, 37, 38 weeks, we can apply a fair bit of pressure, but it's not meant to be painful.
No.
It doesn't. It's not a reflection of how well or not it's going to work. And then we apply pressure to both feet all over and the bottoms of your legs, your ankles, lower part of your legs, and then extra bits of pressure to the areas that are particularly important to try and trigger labour. We usually use powder, especially as feet can be a bit moist, and then we finish off by putting some nice cream. We massage that into the feet.
Lovely. Is reflexology suitable for everyone in pregnancy?
Well, for the whole, reflexology is a very, very safe treatment to have. There are very rare occasions when it's not suitable, and that's why, as I just mentioned, it's really important to have somebody who's experienced in pregnancy reflexology to treat you. If you have a high-risk pregnancy, it might be...
High risk means you have preeclampsia.
Well, that's right. Now,
Carrying twins.
Yes, possibly. Yes, exactly. Now, for preeclampsia, it's more likely that you would be having a gentle treatment with the sole intention of trying to relax you, because we all know that
High blood pressure.
So it would be more likely, in fact, for women who've got a little bit of high blood pressure perhaps rather than preeclampsia, so just people who are, just have high blood pressure anyway and continue to have it during pregnancy, just to keep it at a stable level. And it might be that the reflexologist will work closely with your caregiver and work out a plan that suits any individual woman and feed back to the caregivers too. We wouldn't treat you if you had an infection. So typically the most common infection in pregnancy is a urinary tract infection. Because reflexology can actually exacerbate an infection before it starts to heal.
Okay.
So we definitely wouldn't do it in that situation. Otherwise, very few reasons.
Perfect. How can reflexology be used in pregnancy?
Well, as we all know, there are a lot of very common and normal but very annoying side effects of being pregnant, especially in the first trimester. The nausea, sometimes the vomiting can help with that. It can stabilise your hormones. Reflexology works very well on the endocrine system, the hormone system, and it's the hormones that got you pregnant, that maintain the pregnancy, and see you through labour. So from that point of view, it's a brilliant treatment. Yeah. So yes, early on, nausea and vomiting, it's great for that. Later on, as you get heavier, it can be brilliant to treat backache.
Oh, really?
Yes, it can. And also for varicose veins, stimulate your circulation in your legs and your feet. So if you're having trouble sleeping, it can help you to relax and induce sleep. And I think if you've slept well, then it has that great knock-on positive effect. Definitely. Where you will go about your daily routine. You will be more inclined to exercise. You'll be
more positive.
Much more positive. You'll eat better.
Yeah.
You won't crave for those sort of
Sugary
comforting,
snacks.
sugary, carbohydrate-laden snacks,
Yep.
which you do when you're tired.
Definitely.
So we all know that feeling. So yes, it's brilliant for helping minor
At any
ailments
stage in
at any
pregnancy.
stage of pregnancy. Yes.